Hello everyone. The presentation today is based on our research on the necessity of a confinement lady's presence at the early stage of postpartum. I am Nurfarah Athirah and I'll be presenting this paper with my colleague Nurfarah Athirah Abdullah Siddiq. We are from the Faculty of Social Sciences and Humanities, Kuala Lumpur. In our presentation, we will introduce our study and talk about the methodology, results and discussion, and we will conclude our presentation. Postpartum treatment and confinement is a cultural practice in Malaysia despite the modernity. The current postpartum practices exhibit the integration of modern and traditional treatments. To treat postpartum mothers, it would be best if family members could hire midwives to help them during the early stages of postpartum. Traditionally, confinement lady is known as bidan among the Malays, puyit among the Chinese, and marituvashi among the Indians. The word confinement lady offers some modernity touch to these ladies, but most importantly, they receive formal training. What is the pertinent issue? What is the pertinent issue related to the practice of hiring a confinement lady for postpartum mothers in Malaysia? First, we need to understand that the treatment and care given by a confinement lady is one of the prevention methods to postpartum complications. However, hiring a confinement lady would incur extra costs. The effect of this is many mothers opt to have confinement at the family home, while some mothers go through confinement alone. So there is a higher potential or tendency of getting postpartum depression when a mother does not receive a good care during the early postpartum stage. Compared to family members, a confinement lady receives formal training to care and manage postpartum mothers. So the necessity to employ a confinement lady should be discussed. The study explores the perception of Malaysian mothers on the necessity of a confinement lady's presence in the early stage of postpartum. The methodology that we employed in this study is a quantitative approach in which we conducted an online survey on 135 respondents. We analyzed the data using the descriptive statistical analysis, as the analysis provides summary frequencies such as mode, mean, median, and maximum and minimum scores. For the survey instrument, we developed our own questionnaire and sent it to an expert to be validated. Basically, we followed all the process of a valid questionnaire. We use SurveyMonkey as a platform for the online survey. In terms of the participants, they were chosen based on purposive and snowball sampling. Now, let's look at the results of the study. Over to you, Nurfarah Athirah.
Thank you, Dr. Shura, for presenting the introduction and the methodology of this study. Now, I will be presenting our study's results and discussion. There are three main findings found. The first main finding is on respondents' view on postpartum treatment. The second main finding is on respondents' experience with confinement ladies' care. And the third main finding is on respondents' willingness to spend for confinement treatment. We will now look at each of the main findings. Okay. As for the first finding on respondents' view on postpartum treatment, Many of the respondents agreed that postpartum confinement is important to be done by newly given birth mothers, as 92.62% responded that postpartum confinement should be done. When asked about whether newly given birth mothers could be left alone during the postpartum treatment period, 81.97% of the respondents disagreed that newly given birth mothers should be left alone during that period. Through the responses given in question 10 and 11 in the survey, it is evident that the respondents agree with the correlation of not leaving newly given birth mothers alone during the postpartum treatment period, and the possibility of having postpartum depression after the first child's birth is high. According to Dadi et al. 2020, 50% to 80% of women commonly experience postpartum depression from the first day of childbirth. Another study by Upadhyay 2070 posits that there is a prevalence of postpartum depression with suicide amongst women in India. This is certainly suggesting that women should not be left alone during the postpartum treatment period, as they are vulnerable both physically and mentally. Next. The second main finding is on respondents' experience with confinement ladies' care. It is evident that not many of the respondents receive good postpartum treatment service from the previous confinement lady, as the weighted average is only 3.71 from the scale of 0 being extremely poor to 10 being excellent. When asked about whether the previous confinement lady gave them consultations on the suggested diet regime, hygiene, healthcare, and visit to the hospital to avoid postpartum depression, 61.47% of respondents said that they were given the consultation, while the remaining 38.53% respondents said that they were not given the consultation. The respondents were also asked to whether their previous confinement lady gave them aftercare services, such as visitations to check on the mother and the baby. 51.35% of the respondents answered no, while 48.65% respondents answered that they received aftercare services by their confinement lady. It can be inferred that the postpartum treatments as aftercare services is still not widely practiced in Malaysia. Dadi et al. 2020 asserts that certain types of social support may prevent the onset of postpartum depression. To highlight the need of postpartum treatment after care service, Milgram et al. 2005 affirms that postpartum treatment successive health visit will increase the chance of mothers to endure postpartum depression, which can lead to the cure in the future. The next slide. Finally, the third main finding is on respondents' willingness to spend for confinement treatment. Our findings suggest that many respondents did not mind spending extra money for postpartum treatment if it is given by authorized and certified confinement ladies. The percentage of respondents who would want a confinement lady with level 3 Malaysian Certificate of Skills or a confinement lady with a Malaysian Diploma of Skills each received 23.15% and 49.07% respectively. According to Faraday 2018, in order to give better care towards patients, confinement ladies should be given enough practice and exposure in line with the skills that they have. This way, confinement ladies can act independently and fulfill their duties according to the rules and ethics being ruled out in their profession. And in conclusion, this paper seeks to explore the perception of Malaysian mothers on the necessity of a confinement lady's presence in the early stage of postpartum. Based on the data analysis, the majority of the respondents agreed that a confinement lady's presence is necessary and important during the early stages of postpartum. The study points to the need to have an affordable and high-quality confinement service, since it plays a significant role to support postpartum mothers in Malaysia. As a recap, we have explored the introduction, methodology, results and discussion, and finally the conclusion of our study on the necessity of a confinement lady's presence at the early stage of postpartum. That is all from the both of us. Thank you for listening. Assalamualaikum.